Ma'am, should I start? Oh, it's done.
Is it visible?
Yes, ma'am, it's visible. You can make it slideshow.
Not fine. Okay, fine. So here, the quick access to research methodology, a wonderful session for 8 days. And mine is research design. So first of all, let me welcome all to this, my presentation. So today we will be exploring research design, a critical component in conducting effective and credible research. Think of it as the foundation of strong study, just like how a solid building starts with a good blueprint. We will walk through different types of research design, so how it could be used, and what are all the types of research design, and how to choose the best one of your research question which we are planning to frame in your research process, I mean, your study. So what is the meaning of research design? I think it is a very huge content which I want to, within time stipulation, I try to complete and try to do my justification. So the research design is an essentially a strategic blueprint of this research study. I think you all must be knowing that. It lays out how you will connect your research question to data collection and analysis method. Imagine the designing a bridge. You need a clear plan before you start construction. So similarly, a research design answers the research questions which you have framed. What are you studying? What comparison will you make? Where will you, where will the data come from? Where are you going to collect your data? And how will you minimize a bias? Is it practical or ethically followed? For example, let me explain. If we are studying the effect of a new teaching method, your design should clearly show how we will prepare or compare the student performance across the group. So here I can say that when with regard to research design, when we talk about, it is an architect plan for your study. So if your plan is properly made, the entire research process, what you're planning for, would be a better, and you will have the outcome of your research study will be a pakka one. So here research design as such, how you are collecting the data, how you are going to interpret by using the statistical endeavor, it will be combining of all those things. So here, how the research design, good research design should be. So as I told already, it is directly support your hypothesis. What is your prediction? What are the assumption you have made before you could conduct the study as such? And it minimizes the bias, works with your valuable available time and resources, and meets the ethical and safe and requirement. For instance, if the study aims to test the new medication, the design should include randomization, proper control group, and safety protocol to protect the participants. See, here, if you want to frame a good design as such, or build a good research design as such, it should be basically depends upon the purposes or the aim of the study which you have framed. And also, if it is being prepared or designed in a proper manner, there may be a less bias will be taken place, and how far you are going to conduct the study with the time duration or the money material it talks about. And main thing, how would be the research outcome would be, whether it would be really beneficial for the society, beneficial for the patient, or beneficial for the participant. Or so these are the things to be considered when you taken up the research design. So here, how it does it spell out. So first thing, you have to prepare a paka purpose and questions. What exactly are you trying to find out the thing? So here it does mean that, sorry, my slide has gone. Is it?
No, ma'am, your screen is visible.
but for me it is not. Okay. So here, and the thing is, the logical of comparison, what must be compared, whether you're comparing the groups or time points or any, how you're going to answer to those questions. And data pathway in the sense, where are you going to collect the data from and in what, which order? So you should be very clear about this. Research design will settle all those things in a proper manner. And controller bias, how will you rule out the alternative explanation? And ethical practical fit, whether your study, what you have designed, as whether ethically proven, or can it be done the resources, time, and ethical safeguards? So here, what I can say is that if you are very clear about these questions, then your design, what you are what you are plan to select will be a right design. And also, you have to look for these questions. Now, when you answer to these questions, again, you will be able to answer to what is your research question. Can it be done with your resource time, and whether it is importantly will find out the proper finding properly in a matter. For example, we can say that if you are studying upon whether if you are wanting to examine whether the texting while walking affect the balance might seem simple, but need to pause all these checks to be taken seriously. So these are the things you have to keep it in your mind before you could select the research design. So let us see what are the domains of research design. So here there are three domains: descriptive, differences, and relationship, where you could see it on the screen. If you are comparing the group, what is the difference between, if you are going to find out the difference between two or more groups, and where you can have the differences. And if you have one group and measure a dependent variable two or more times, again, you will find out the differences. If you want to relate between the two groups or measure the independent variables once, it is called a relationship. And if you have one group, there is no independent variable, and observe the dependent variable, again, it does mean that it is a descriptive. So these are, so when you take up the research, when you think of the research design, see to that these domains, all these domains to be considered, which will be eliciting the what is the differences, whether it is you are going to find out the differences, whether you are going to compare between the groups, whether you are going to relate among the groups, or whether just like that, what exact fact you are going to deal with. So these are the things you have to consider. And let me so it provides a specific blueprint, as we have already seen, and also making a proper way of framing a research design. It will control these variable factors which are influencing the result. Sometimes extraneous variable may come and influence your proper result. Thereby, your result may be in a different manner. You can elicit with a different manner. So this research design will control the extraneous variable, and the research design is the end result of series of decision made by the researcher, and thereby you can be very well, very voluntarily, very boldly, very confidently, you can elicit or you can compare or you can provide the research result as such in a proper manner. And let us see what are all the elements of research design. So when we think about the research design, so these are the elements is a must. One is intervention. As you know that it is the effect on phenomena. So what you are going to intervene, what to intervene, what are the procedure you are going to use for doing your research purposes, for whom, and everything you have to consider in the content of intervention. And also the next component, the next element in research design is that comparison. So here comparison between two groups, or whether comparing with a single group or one or more points of the time, and comparison in a single group under different circumstances, different situation, whether you are going to compare among the groups in a single manner. So likewise, you have to clearly know, or clearly you should know about the comparison as such. And also group, each group in a design is given its own line in a research design. So this here, whether you have allotted the random assignment, and also non-equivalent groups and assignment by cutoff, these are the things has to be considered when before you could take up the research design or confirm the research design for your research process or the research study as such. And here some of the tasks which are being involved in the research design. So these are the steps are being involved in. First thing, okay, I want to do some research work. I want to select one research design. So first thing, you get an information. So you have to make a field work in which are the areas it is actually in need of. So define the information needed. So what are the resources available you have to collect, and accordingly here you have to do some desk work or a homework. So which are the design will be suitable for me for that research purpose study which I have selected. So what are the phases which I'm going to, whether I'm going to take a non-experimental design or experimental design or mixed method or qualitative approach, everything you have to clear about it. And it specify the measurement and scaling process. So here, how are you going to scale the procedures, what I have selected for my research study, research design. So how are you going to scale or measure these variables? So how many variables are there? So everything has to be specifically mentioned. And after that, you have to mention or prepare your questionnaire for your opt question for your research design. And then after that, you can go for your what samples, what technique you're going to select, and how you are going to determine your sample size for your particular research design which you have selected. Everything it should be. And after that, you have to all the process like data analysis and data plan has to be considered. So here, which I want here. The thing which I want to say is that the concept, the important thing, for the research design. So what are the things, what are the concepts which are very important you have to keep in your mind is, first one is casuality. What do you mean by casuality? Anybody knows casuality? Yeah. Casuality refers to the relationship where one variable in the sense the cause, and directly affect the another one, the effect, cause and effect. How one variable is affecting the another one, that is which means maybe effective. For example, we can just quote, administering a painkiller leads to reduction in reporting pain levels. So here the drug is the cause and the pain relief is that effective. So here, how far it is being related with variable, how it is one variable is affecting with affects the another variable. So that thing has to be considered by the researcher. And second one, multi-casuality. What does it mean? So this will be, if we can have when multiple factors like, when multiple factors, for example, together contribute the single outcome. So there may be some multiple factors, but the outcome will be on single one, the one. For example, a patient recovery from surgery might depend on nutrition, or so there may be multiple factors like the person who is recovering from the surgery might depend on nutrition or physical therapy or emotional therapy or medications, but all are acting together for the purpose of one outcome. So this is what called as multi-casuality. And what does it mean of probability? Probability, it refers to a likelihood or chance that a specific outcome will occur. For example, the possible outcome, the likelihood or chance to occur, take place. A study might estimate that there is a 75% probability that smokers will develop lung-related diseases over 20 years. So this is an apt example for probability. So these are the terms which must be knowing the every researcher, so that we'll be able to incorporate these terminology when we come into the real fact. So next concept which the important to this with related to research design is bias. So what is the meaning of bias? That means it is something like any influence that distorts the true relationship between variables, affecting the validity of the result. For example, if a researcher subconsciously or unconsciously gives more attention to one group, so it is again give unfairness. I mean, it gives a bias. We can call it as a bias. It can give result known as researcher bias. If one is, suppose if you are giving much more focusing on one group, not giving much more important to other group, so that means it is bias, because this relationship which will affecting the validity of the result. So which is called bias. And coming to as most of you are knowing about the manipulation, it involves deliberately changing or introducing an independent variable to observe its effect. For example, let me say, giving one group a new drug while another gets a placebo. So the drug which is called as a manipulation, how we are manipulating, how we are influencing the particular group of particular study group. So this is called a manipulation, and must be knowing that what is the difference between manipulation and intervention. Here is the meaning. The intervention means it is a specific treatment or a program or action introduced during the study to observe the effect. So which is called intervention. So now you must be knowing that what is the difference between manipulation and intervention. So here the example of intervention is that implementing a stress reduction workshop to see if it lowers anxiety level of the nurses. This is excellent example which I want to quote with regard to intervention. And coming to independent variable, what does it mean? It is again, this is a variable the researcher changes, they can have a control over it to observe the effect on the dependent variable. This is, for example, changing the number of study hours to see the impact of exam scores. The study hours is not important because at any time it can be. So here, the independent variable, when we talk about independent variable, where they have, the researcher have the control over it at any time. Okay, and a coming extraneous variable. In many questions, how, MSc dissertation, they may be asking, the examiner must be asking, how are you going to control the extraneous variable? So by knowing the meaning, we can easily answer to such kind of questions during your Viva too, So extraneous variable, these are the variable not of interest in the study. They say they're not included in the study as such, but it may influence the result if it is not controlled. So they may not be involved in our research as such, but they might be having influence to control over our result. For example, in a study on diet, on weight loss, physical activity is an extraneous variable. Physical activity, because physical activity may not be included in our study, but perhaps this also may be included. It may also influence our main study. This is what called as extraneous variable. And coming to, of course, pre-test and post-test design, there are measurements taken before and after the surgery. So now we are very clear about, I hope that you are clear about what is the concept important to design. And now let us go on to the types of research design. There are three types: quantitative, qualitative, and mixed. What do you mean by quantitative? Where it is a casual, it is numerical value, numerical data, where you can use your statistical analysis and all those things. So where you can find out the relationship between two variables and numerical data, and it can be measured statistically, it can be analyzed. What do you mean by qualitative research design or approach? So it will be exploring the experience or meaning of the process of the particular task, particular textual, through rich textual, or simply we can just like subjective data about all the incident, all the experience, what they have performed, and thereby you can collect the data via interviews, observation, and documents. Also, what do you mean by mixed method? Mixed method, it is the integration of quant and quality, quant and qual. So integration of quality and quantitative standard in a single inquiry to obtain a fuller it will come to the picture as such. So here some of the designs in a quantitative design approach, where you have experimental and non-experimental. Here you have descriptive and correlation and all those. We will see one by one in a detailed manner. So these are some of the types of descriptive which are coming under your non-experimental design. So what do you mean by descriptive design? So descriptive design research is undertaken to say the fact alone, to describe the answer to questions of who, where, when, and how. So it is desirable when we wish to project the study finding in the large. So it would be useful for a larger findings of the people, So here, So when you are, so here we can say that these are the very useful for mapping trends. For instance, a cross-sectional study could measure how many school children in a district have access to the internet. This is something, the real fact. It is survey. We are just collecting the number and just disseminating with the result. So this is what called as research. So it could be used for larger population, and also in a larger population. If you are using it, is the one study can represent the entire population as such. So in the longitudinal study also might track the number of over 5 years like. So this is an example for descriptive study. Now you must be knowing that what is here, just giving the explanation or describing so already you have got your, with regard to descriptive study, there will be a research question. Whether you are answering, whether you are able to describe that particular question which you have framed is a descriptive research study, to whom, what, where, when, and how, all those things you have to clear out. And these are some of the types of descriptive research design. First one is typical descriptive. So here about painting a picture, just like a census. So what, just like a just how we are, which color you are going to frame in hair, what color, it would be a black color. So likewise you are describing, no? So it is just like a sensor or a health survey. For example, we can say a study to identify the prevalence of cervical cancer in one particular area. So just we are going to find identifying the persons and what is the possibility to identify the prevalence of cervical cancer. So this type of study is called as typical descriptive. And what do you mean by time dimension? So here the researcher would be examining the sequence or pattern of change, growth, and trend over time, focusing on the changes or trend over some period. For example, here you can say that the effect of maternal labor analgesia on feeding behavior of newborn, and multi-peer counseling and juvenile delinquencies. So here, and how often we are conducting, it's with the time duration, the period, what are the changes are being taken place, what is the pattern of changes, or there is any growth. If we are disseminating that result, it is called time dimension. And longitudinal, in the name itself, we can say over the extended period, the data will be collected more than point of the time over for example, they study the changes of professionalism among BSc nursing students. At one point of view, this result cannot be revealed, but we have to have over the extended period. One thing, maybe 2 years or 3 years or 4 years. So, starting from the admission of the student and when she really when she leaves the institution or the college, so the whole duration, this type of study could be done. So this is what called as longitudinal. This is also one of the kind of descriptive research design. And cross-sectional design, here the data are collected in one point of within time duration. So for example, we can say that here also within a particular period, the study, the changes in professionalism among the for how the professionalism behavior of the students. So within 3 months, what is the attitude? Like that, if you plan for it, this is coming under the category of cross section. It is also a kind of descriptive study design. And coming to correlational design. So what do you make in the name itself? We are relating that we are interrelationship or association between two variables. So here these assess how two variables move together, and they don't prove cause. They no need to prove the cause, but how it is being related with one another. Each with a relation between two variables. For example, we can just say the study might students who sleep more tend to score more marks. But it does not mean that sleep alone causes better grade. So this is what, so here what we can get, under the sleep and the higher score, we are interrelating or we are associating between these two. It does not, we are no need to bother about the cause as such here. And here again, this again has got subdivisions also, like descriptive correlation. It describes the relationship among the variable. For example, coping with the disfigurement and length of hospitalization after head and neck can surgery is what descriptive. So they are finding out the fact between by connecting the two bits. And predictive correlation, which will expose what factors have an influence on one another. For a correlational study to predict intention to obtain pap smear among urban and rural women. So this is, we are predicting what is their concept, what is their thought in their mind. So everything we are predicting, we were exploring what are the factors that which will have an influence to another variable. Like, and coming to model testing. Model testing, it is something like, testing the hypothesis casual model. For example, we have some prediction or the hypothesis in our research process, and by the variable, by the research study, by the samples, whether it would be practically tested. We can even frame the model as such by correlating this data, what we have got it in your mind. Already we have one hypothetical model, hypothesis statement. But based on that, we want to prove, as a researcher, we want to prove that. So by whatever data we have it in our hand, we are correlating with the data and finding out the model, like this is what. And multifactorial correlation, this is again, we have got some multifactorial correlation, but like for example, in the there may be so much of variables which can be related with each other, but the outcome will be what it would be. So that will be dealt in that multifactorial correlation as such. Am I audible? Am I audible? Hello,
Yes, ma'am.
participants?
Sure, ma'am.
Is it?
Ji, ji.
Okay. And, this is a correlational study to predict intention after pap smear. And model testing here, the testing a hypothesis casual model. When you already have a theory or model in the mind, you want to test whether the data supports it. It is about confirming the relation between the variables behave the way your models. So this, for example, hypothesis model where patient nurse communication and medication adherence all contribute to improve the recovery of the patient outcome. This is the example of model testing. Already we have got a model, hypothesis model, and we want to prove with whatever the collector which we have. And multifactorial correlation, how multiple variables together influence on outcome. For example, what influences nursing students' academic performance? You could look at study hours. So it is one of the factor, and sleep quality, again, one of the factor for determining the academic performance, and stress level, again, also one of the factor, and part of time. So these are some of the multi-factors, like study hours, sleep quality, and stress level, and part-time workers, how it will be influencing or interrupting or improving the academic performance. So this is what a multifactorial code. So each thing has to be correlated in the multifactorial correlation. And coming to retrospective research design, it is mean that it is again, yes, something very interesting we can do. It is something like a detective work. We can begin with the outcome, say a group of the patient with the heart disease, and then look back through their medical history. So already look back, going backwards. So already the patient has got a heart disease. What would be the reason for that? Whether it may be the finding out whether the cholesterol level is being increased, or whatever the physical activity of the patient, everything is being collected. Already what it is that. And so it can be obtained through their medical history, life style, and risk factor to see what might be led to the result. So first, initially, we'll be having the outcome as such. In order to find out, in order to confirm that a particular outcome, for example, heart disease, what may be the other factors. So going back to the the factors, like to find out the result. And case control, this design compares the individual who have got certain condition cases with those who do not. So here already those who are suffering with some other particular disease and who are not having that particular condition, they are considered as a control to identify what might have the cause of the outcome. So this is what case control study. And prospective, that does means futuristic. So start with a group of people who have certain exposure or characteristics and follow them into the future to see what outcomes develop. For example, smoker, you can compare the smoker and non-smoker and then observe over the time period who develops lung cancer. So this is a proper example for prospective. So prospective in the sense for futuristics. So with the certain exposure characters, how would be the outcome? We are foreseeing the things, how it would be. So this is what called as prospective. This is how we can do a prospective research design. This is also a coming under the non-experimental as such. I think you are clear about a non-experimental research design. It would be very interesting too. And coming experimental design. So experimental design, it is considered to be a gold standard. So nowadays, we then in our nursing fraternity, we are encouraged to do experimental nursing research work. So here there are some of the series steps to ensure the relevant data will be collected, and we can even make a we can prove that what is the hypothesis, how whether it is accepted or not accepted. So likewise, we can even do all kind of thing. So there are here. So here we can have how it be done, what is done. It is here we can use the word. So systematically, when you think about if you are doing an experimental research design, you think about that it has to be followed in a step-by-step manner, systematic, and you should have a scientific approach to the result. So scientifically, you have to prove. Scientific research knowledge you should have. So where you can have your manipulation, you know what is the meaning of manipulation, one or more variable, and you should have a control or randomization and measure any change. So here you can have a control group or a subject, and it can be randomly selected and can be done in the effect at the one time. So this is what the main essence of doing your experimental research design as such. And what are the functions of experimental research design is, of course, research question. It will be clearly, objectively answer your research question, and it can be validated, it can be measured, and economically it can be proven. And it will be enabling the researcher to control undesirable variants that I said. We can, by doing your experimental research design, where you can easily control the extraneous variables, whereas it would be difficult to control the extraneous variable in descriptive design as such. And let us see some of the characteristics of experimental design. There are 5 characteristics, which we will be seeing one by one. If you all know that when we think about the experimental research design, see to that it should be comprised of all these characters. It should possess all these characters. One is randomization, control, manipulation, observation, and replication as such. So randomization, of course, you know that there may be a various data, all they will be there, but see to that at the one point of view, we are giving equal chances to all the participants who are receiving the treatment. Randomization. And method of randomization, if you all know that lottery method using a coin and random number table and computer. So lottery method, I think you can just put it all the seats in one this thing, no, one part or one cap like that, where you can from that you can pick one point where it can be considered as a whether it can be allotted for study group or control group like that. And even tossing the coin also, if it head or tail, if it comes. So you can be the researcher have all the right to decide whether that head is for study group or tail or control like that you can have. And also random number table and computer wise you can select randomization. It is a very easy when you practice. And coming to what do you mean by manipulation? Manipulation is the process of maneuvering the independent variable cause so that it affect the dependent variable effect can be observed or measured. So deliberate introduction on operation of oil. And method of manipulation, here you can do some of the method. The researcher gives intervention to the experimental group, its study group, and withhold it to the control group. So one group will be exposure to the manipulation intervention, and the other group will not be given, or placebo effect, or will not be given. So this is how we can manipulate the intervention. Gentle massage is effective as a pain relief measures for elderly. So here is the treatment variables. And control, what do you mean by control? They are not of interest of the researcher, but still affect the result. But though it is not, any intervention is not been given, though the withholding of the intervention is being carried out, but it at any cost, but there is a still it will affect the result of the entire study. So we have to be very careful enough when you are handling the control group of the people. So it refers to a group of subjects whose performance is used to evolve with the performance of experiment on the same dependent variable. For example, given effect of deviant diet on the weight of premature infant in 2 weeks. Comparison of post-intervention weight with the prevention weight determines the effectiveness of nutrient diet. So here one group is given exposure and another group is not being exposure. This comparison. So but after that, like after the period of one time, so we are comparing the both the groups and find out the effectiveness here as such. And here, this is this picture, it depicts how the entire patient, how the random was carried out here for treatment, the random molecule, and how it can follow the group and control group. And at last, we are comparing the group result and finding out the result, whether your intervention is effective or not. Here, the manipulation is also being taken place here. And observation. The next characters of experimental design is it with the manipulation of independent. The dependent variable is studied, observed. The technique of observation is applied if measurement is not here. Some of the records, whether any change of our records or appear being changed, or any change in the appearance or disappearance of the independent variable. Some few studies where you have to when the measurement is not possible. Some of the, like for example, clinical parameters and all, no, where you can this thing, like appearance of the skin color, everything we can the after doing the particular dressing, how far the wound structure or the appearance of the wound, everything can be monitored by through observation only. And replication, of course, after that we can review do some number of sub-handled within the framework. We can even, it is not only stopped with it, and by making use of that, we can do some replicated work while doing your research design, experimental research experimental research design as such. And of course, for experimental design, it is very much needed that content, internal validity and external validity to value your research design. This is very essential. So internal validity, of course, you know that the fact of evidence to assert whether experimental treatment made in a difference. And by strength here, the external, when we talk about the external validity, so it is something like that the degree of the result of the experiment can be whether it can be generalized. So for generalization purpose, we can make it out the external validity and internal validity. If you take this topic alone, it will take again 1 hour. So internal validity and external validity, it is a must when you are carrying out the experimental research design as such. And these are the symbols are being used. As you know that it's R stands for random selection of random assignment, and X treatment and experimental variable, and O means observation. So these are normally for experimental. Now symbols are being used here. And so what are the steps to be followed when you are thinking or wishing to have study on experimental design? First, initially, you have to and find out the resources, background of this. Collect you have to make a study field work, you have to do it. And construct the hypothesis prediction or significant scientifically you have to predict what would, if I do this research, what would be the outcome. So you have to construct the hypothesis, test with an experiment and procedure working, how it is working. If you find, if it is no, then troubleshoot anything. If you find any flaws in that, and go for what else we can do. Again, go for the experiment, test the experiment. If it is yes, then you can go for analysis and result, and come to the communication. If the data, experimental data becomes background research for new future project, ask new more questions. So it can be general. This is what called as replication. I can say that it is not only stopped within one project or one research as such experimental. You can even generate so many research questions from one particular experimental design, where thereby you can replicate your study and have a very expand your research knowledge in that particular field of your interest. So these are the steps involved in conducting an experiment. Identify the problem, and review of literature has to be, the resources is a must. The resources, time, the money, material, everything has to be. Yeah, yeah.
Is that issue? Ma'am, your screen has been stopped.
Is it
You can
visible?
reshare. No, ma'am. No, ma'am. Maria, ma'am, you can reshare your screen.
Visible?
Yes, ma'am, visible. You can make it slideshow. Yes, now it's okay,
Yes,
ma'am.
it's only visible.
Yes. Yeah, visible, ma'am.
Okay. So here, these are the some of the steps here, formulate. So after doing a review of literature where you can formulate your hypothesis, what are the possible hypotheses could be framed or formulated to detect that, and also in which are the ways where you are going to collect, in which are the ways, what are the ways to conduct your experimental design. That also can be the tools and questionnaire, everything. If you should have in your hand. And after that, once it is been decided, you can go for your data. You can very well go to conduct your experimental design. Then after that, you can collect and compile all the, once the data is being collected, you compile all the data, and and you can, and also find a date, go for data analysis, coming for your conclusion and result assess. So these are the 7 steps you have to follow when you are follow, if you are decided to uh, apt for experimental study. And now let us see the types of experimental design. So first thing, for experimental design, to that the random allocation, all the participant has to be selected random. Random assignment should be there. If random assignment is allocated, random allocation is settled for, then it is called as a true experimental design. If any one random allocation is not, assignment is not there, and control group is not there, anything is missing, then it is called as a quasi-experimental. And is there any, uh, is there a control or comparison group or multiple measures, then you can go for quasi-experimental, but random assignment will not be there in quasi-experimental design. But when you are coming to pre-experimental design, where you have only one group, there will not be any control group as such. So here we can call it as a pre-experimental design. So here an example for pre-experimental design. So there are 2 types of pre-experimental design, one-shot case design and one group pre-test and post-test design. So let us see one by one in what one-shot case design, one shot. A study of single group at single occasion. At one time, a single group is being selected for a group of our research, a research purpose. For example, here you can say that there will be a group of, a study group would be there, only one group, and the treatment will be carried out, and immediately that single occasion, the posters will be carried out. For example, new book increases the interest of the student. So here, if you want to find out, we can select one group and do the treatment. Treatment as such, you can do some intervention as such, find out, you can provide some questionnaire and find out the post test in a single location. This is what called as one-shot case design. So here you can just see. Experimental group, treatment is given and post test is being carried out. One shot treatment. And one group pre-test and post-test design, it is otherwise called a pre-experimental design, where you have a group of study people. Pre-test also will be carried out, but no randomization. And the treatment is given, intervention is given, and post-test. For example, we can just say that, what is this? Just a minute. Using a clay as an anxiety reducing intervention. So using clay is the treatment intervention. The main thing to pre-test how for the anxiety level, and after the treatment, how for the anxiety level. In the psychiatric hospital. This is group one, the one group pre-test and post-test design, where you do not have a random allocation or random assignment. Randomization is not being carried out. Whereas you have the, and also control group also is not there. Only the study, with the study group we can do it. And coming to quasi-experimental design, quasi-experimental design may be defined as a quantitative research design in which there is always manipulation of the independent variable and control measures are employed. But the other element of the true experiment, random assignment, of course. So here, when we talk about the pre-experimental design, where you do not, with the one group, the study group alone, we do, where there is a lack of random allocation, random assignment, and no control group. In the quasi-experimental, where you can find that there won't be a random assignment, but preferably we are having a control group as such. So here, these are the types of quasi-experimental design, non-equivalent control group design, and time series. So here, quasi non-equivalent control group design, where you have the study group and a control group. Here, we are giving the intervention to the study group, and post has also been carried out. The control group, I do not have a intervention, but post test is being conducted. And non-equivalent control group post test only. Here, pre-test will not be conducted, only post test alone. So here, you can just see the picturized form here. So here is a control group, the study group where the intervention is being carried out post test alone. Here, directly we are going for the post test. This type of design is called non-equivalent control group post test only design. Why it is non-equivalent control group? We are giving equal chances to everybody, just like that. The random assignment is not preferably not provided in that quasi-experimental research design. And coming to time series, again, it has got two types. One is single group interrupted time series, control group interrupted time series. Coming to single group interrupted in a single form as such. So in a one group only, we are doing, the measures only group repeatedly before and after exposure to the treatment. The measurement is being done repeatedly here with the one group. It is called single group interrupted time series design. And control group interrupted time series is same like, whereas here we have the control group. So N is for non-randomization and single group and study group and control group. So this is a difference. So in time series, where you can even chance for doing a two types of time series research design. One is with a single group, we can do is called single group interrupted time series design, and control group interrupted time series, where you can have your control group as such. The experimental group is exposure to treatment at the same point. And again, counterbalance design. This is also a coming at a time series. So here, counterbalance design is similar to the crossover design, experimental design, except the subject are not randomly assigned. Here you can just have 4 different groups would be there. 4 different groups. First group, second, likewise you have. And in second group, second intervention will be given. And third group, third intervention. Likewise, there is we can have we can have 4 groups where you can 4 different types of treatment can be applied, and at last each of the group or the individual a post test after each treatment, and after so here the number of treatment and the group must be equal. So which is very important that when you think of counterbalance design, where you should have a the number of treatment, 4 treatment should be there and 4 group of people should be there, so it should be equally distributed. And coming to, so this is what quasi-experimental design. Coming to true experimental design, all the 3 domains will be included. Control over the extraneous variable, and manipulation should be there, randomization should be there. And intervention also, experimental group and manipulation should be there. So here some of the examples of, we will see one by one in detailed manner. Post-test only, pre-test, post-test, Solomon, randomized block design and randomized block design control, block design and crossover designs we have. So let us see post-test only control design. So this means here you can look at the picture here where randomization is being carried out, equal chances have been given, and the study group is being exposed to the treatment and post-test is carried out, and control group as such where they're not exposure to the treatment group as such, and post-test at last, post-test also is been conducted. So no pre-test, but only post-test for the both the group is been carried out. This term is called as post-test only control group design. We can do it. For example, here just to study the effect of an educational intervention related to urinary incontinence on the subsequent help-seeking behavior of the older people. So here we can, pre-test cannot be conducted, only post-test is being conducted over here. And this is a picturized form here. So again, one more example I have quoted here. The effect of laughter therapy for 50 faculty, control group and study group. No intervention, post-test to burnout. So only post-test can be. So here, these faculty, 100 faculty are being randomly selected, which is very important in true experimental design. Then pre-test and post-test design. So pre-test also conducted and post-test also conducted with a random assignment. Pre-test and post-test. Here study group, pre-test is being carried out, and treatment, the study group are exposed to the treatment and post-test again conducted. And the control group, where you have random assignment carried out, pre-test of course conducted, but they are not being exposure to treatment or any intervention as such, and post-test is being carried out. So this type of the research design, it is coming into true experimental design, pre-test and post-test design. So for example, again, with the laughter therapy only, they assess the effectiveness of laughter therapy. So here you can just see pre-assessment is being carried out, assessment of burnout, pre-test, and laughter therapy carried out for the experimental group and post-test. So here when pre-test is conducted, here you can just clearly, I hope clearly you have understood this about by seeing at this picture as such in with regard to pre and post-test, pre-test and post-test research design. And coming to Solomon 4 group design, where you should have 2 study group and 2 control group. Random assignment should be there, of course. Random assignment for any experimental design, random assignment should be there. And pre-test done for 1 set of group, study and control group. Here you can just see. So this is, we can say that it is a combination of pre-test post-test design with the post-test only design. You just clearly observe this. So in the first set where pre-test conducted, treatment conducted and post-test carried out. Whereas in the second group, just in the experimental group 2, experimental control group, where only post-test is being carried out here. So I give it, in order to make for you all to understand clearly for the memorization, we can just say that pre-test post-test design, the combination of pre-test post-test design and post-test only control design is called Solomon 4 group design. Okay. So here you can have a good example of that with the same laughter therapy. So first here pre-test assessment, laughter therapy and post-test. So this you can just see the combination of pre-test post-test design and only post-test design here. And coming to factor, am I clear? Any confusion? Audience, participants?
I hope it's
Participants?
clear. It's clear,
Okay.
ma'am.
And
Participants can drop
factorial
any
design.
query if you have.
Factorial design. The manipulation of two independent variables simultaneously to observe the effect of the dependent variable. So this design is usual when there are more than two independent variables called factors to be tested. For example, we can just say that the researcher wants to observe the effect of two different protocol of the mouth care prevention of VAP when performed at a different frequency in a day. So here the design also facilitates the testing of several hypotheses at a single time. Typical factorial design incorporate 2 into 2 or 2 into 3 factorial, but it can be any combination. So here you can just say the first number A refers to the independent variable or types of experimental treatment. Understand? The first number is A and second number is MB. So here you just see. So every fourth hourly, sixth hourly. So the two combination of protocol for chlorohexidine and saline. So how far it is fourth hourly, this combination of this drug. Then at last finding out the factors which is been influencing for the particular, whether it is effective or not. Like that, we can even do the factorial design research study. And coming to randomized block design, when there are large number of experimental comparison group where we can, so this randomized block control design, which will be very, the one advantage here is that it will bring the homogeneity of the different group of different experimental group as such. So this design may be looking like a factorial design. For example, here you can say we can make it as a block like that. The researcher want to examine the effect of the 3 different types of antihypertensive drugs on patient with hypertension. To ensure the homogeneity among the subject under treatment, the researcher randomly places the subject in a homogeneous block group as it is called as a block. So here you can say that here you can just see there are 2 factors, type hypertensive, antihypertensive drugs, and the type of patient with hypertension, where only the type of drug is manipulated. Here the drug only is manipulated and type of patient with hypertension are simply grouped. The hype of drug only is manipulated, but whereas the group of people is in a different block is being allocated. The similar with the similar characteristics. Here you can just see that A, B, C, antihypertensive drug, different types of the drugs, and for one patient, for the group of people are being classified as patient with primary hypertension, diabetic patient with hypertension, and renal patient with hypertension. So here, for the first thing, like for the hypertensive drug A, B, C is being allocated, given for a patient with primary hypertension. For the block 2 people, the diabetic patient with hypertension, the second group of division is being given. And third group, like that, it is something like a block. We are dividing the group of types of people, the samples in the block ways, accordingly that the drug of the people, one factor is not being manipulated. That only the one type of drug is manipulated, but the samples or the patients as such, the samples or the participants is being blocked in that conditions. And coming to crossover design, this design also exposure to more than one treatment, where the subject are randomly assigned to different order of the treatment, which is also known as repeat measures. For example, when we are comparing the effectiveness of chlorohexidine and saline care protocol, first we administer chlorohexidine mouth care and protocol on group 1 and saline care on 2 group. So later the treatment is swapped where group 1 receives saline mouth. So it is something like zigzag manner it used to come. So in the forthcoming slide, it is very clearly seen that. So here one group with a particular period of time. First group is exposure to chlorohexidine and second group is normal saline. Then after one period of time, the first group is being exposure to saline for mouth care, and the second group also it is something like a zigzag. So after that we will be finding which one is better here. So here you can just see that. Since this is the example for another thing. So first group are here salt restricted diet. This is the time period is for 4 weeks, 8 weeks. So first phase is for 4 weeks. So group one is given a salt restricted diet and randomization, and group one is called usual diet. So after that, after giving 2 weeks, 2 weeks washout period is given. After that, the second phase starts. So the first group will be given a salt restricted. The second group is given a salt restricted diet. Here you can just see second group, and in the second phase, and first group with a normal usual diet. So this is an apt example for crossover design. It is something like a zigzag manner. So thereby you can just you can easily differentiate, or you can just deliberately say that which is the best thing, whether it is a salt restricted diet or usual diet, because of that, or whether the mouth care, the best remedy for mouth care is chlorohexidine or saline. Likewise, we can easily come to the conclusion. The outcome will be a better. And coming to randomized control trial. This is again an epidemiological experiment in which subject in the population are randomly allocated into group, usually called study group and control group, to receive or not receive an experimental preventive or therapeutic procedure, maneuver, and intervention. So here, how to conduct it. This is what I designed for randomized control trial. Select the suitable population as such and suitable sample. So here, when you select the topic population and suitable sample, which exactly the characteristics of inclusion criteria should be properly made, and make necessary the exclusion. You should be very clear about the inclusive criteria and exclusive criteria. And after that, only it can be randomized. And after randomization, what you can do is you can just divide the group into experimental group and control group, and manipulation. If there is any manipulation, you can go for. If not, and you can do the follow-up, and at last you can make your assessment. This is how you can follow for randomized control trial. So here, in case of any exclusion, see to that if those who are not eligible also can be excluded, and those who do not wish to give consent. So here, for any kind of research design, research work, the consent form is ethically very important. So we have to be very keen of getting a ethical clearance, and also getting a consent form from the participants as such. And coming to this, in RCT, we have so many methods. One is blinding, double blind trial, and a triple blind trial. So by blinding, in the sense, this will be very helpful to eliminate the occurrence of some bias. And we can have it as a single blind trial. Participant is not aware of whether they are belong to study group or control groups. So after randomization, we divide the group into experimental group and control group, isn't it? So here in the blinding group, in the single blind group, the participant may not be aware of whether I belong to experimental group or control group. So just like that, we can do. Only the thing, the researcher would be knowing that. And double blind trial, in the sense, neither the participant nor the investigator is aware of. So both of the persons, either investigator or the participant may not be aware of whether they are belong to which group, like. No, and triple blind trial is the participant, investigator, and the person analyzing the data. So after after collecting the data, normally we go for statistical help. So that person also may not be aware of which people are belong to which group, like, no. So this is called triple blind trial. And coming to the other types are the clinical trial and preventive trial. So here it is done various purposes, like prophylactic treatment, for example, immunization purpose. Recently for COVID, what immunization, how it will be. Now the research is going on that for diabetic, in order to prevent the diabetes, whether there is any chances for using some preventable measures. therapeutic trials. So likewise, so if we proceed for this kind of clinical trial, it is called randomized clinical trial. It is called clinical trial. And preventive trial for the purpose of primary prevention. For example, vaccine trials analysis must result in clear statement about risk involved, benefit to community, cost extra thing. So under which we can do some clinical trials also, randomized clinical trials. And also risk factor trial. This is also for reduction of blood cholesterol and control of BP, or in prevention of cardiac diseases. Some of the trials, risk factors, to find out the risk, how it will be interpreting the development of the diseases, how it develops, everything we can do under the category of risk factor trials. And cessation of experiment, it is an attempt to made evaluate the termination of some of the habit. For example, smoking of lung cancer. So likewise, we can even do for. So these are the things are coming under our RCT. And trial of etiological agent, it is also done to confirm an etiological hypothesis. And evaluation of health services also, we can do it under this RCT. For example, in India, domiciliary treatment of pulmonary TB was ineffective as costlier hospital treatment. So under based on can do the trials assess. So these are the possibility of, these are the some eye opener for us, our nursing, to do some RCT, randomized control trial studies. So again, yeah, along with experimental design, nowadays in a recent trend, what is going on is nursing, even PG or PhD, we are motivated or encouraged to do some RCT design. So these are some of the disadvantages of experimental design. It's the most systematic method and condition. It can be controlled. The data collected can be analyzed. And the findings of the experimental method are very critical examination and verification. And so these are the, when there is advantage, there may be some flaws also. So elimination of extraneous variable, it is not always, mostly we can eliminate, we can control, but sometimes, some occasion it may not be possible. But it does not test the effect of non-manipulated variables. Artificiality cannot be carried out, these are the disadvantages. And coming to mixed method, I told already, so for non-experimental design, under experimental design, we have pre-experimental design, quasi and true experimental design. And mixed method, it does mean that it is a combination of qualitative and quantitative. Qualitative, again, there are still more some slides are there. So here, mixed method, we have convergent parallel, explanatory sequential, exploratory sequential, and embedded and transformative multi-phase. So here you can just see what do you mean by convergent, where you can see the quantitative and qualitative collectively, qualitative data and quantitative data is collected simultaneously and analyzed separately, then merged together. And explanatory sequence, like quantitative phase first. Initially, we carry out the quantitative data first and come into qualitative manner and explain the result as such. And the exploratory, in the sense, qualitative discovery phase first and then quantitative. And embedded, one data set nested within the dominant design. So here it is with our experience only, elaborately we can expand our skill in doing our mixed method. This mixed method also nowadays it is being prevailing in our nursing fraternity, among nursing community. So here some of the examples are being given for the convergent parallel method of mixed method, burnout survey and focus group merged together. And here some of the examples. So these are some of the basic types of mixed method is convergent parallel method, explanatory consequential, explanatory sequential, and exploratory sequential, embedded, and transformative multi-phase. Coming to quantitative, we are presenting in the form of numerical, and qualitative as such, we are projecting our observation, whatever we have made in the form of word. So this is what a main difference between the qualitative and quantitative. Here some of the So here phenomenological. So here what we can say that just when we want to explore the lived experience of any situation, any sample or any participator or any area of the people. So for example, here you can just see exploring lived experience of COVID positive patient. It is a phenomenological way. It has been called as a phenomenological study. We are just in the lived experience. We are going to explore. We are going to get back from the participants. So here some of the lived experience, the individual's elicitation of their experience about particular phenomena. Anything. So how do you feel about nursing? If you want to ask me this question, if I elaborately tell about my perception, my feelings, my thought about nursing profession, what I have faced, how I am living with this nursing profession. So if I talk, this is what called as phenomenological style. So lived experience. Okay. So individual elicitation of their experience about their particular phenomena is called phenomenological study. So why it is very important? What is the need for a phenomenological study? So it is mainly, it will provide the basis and premises of empirical knowledge and dealing with illusory nature of sensory experience. It can be replaced the individual experience with the universal description of phenomena. So by making one individual experience, we can even generalize what exactly the description about that particular phenomena. So this is a main advantage of phenomenological design. And this is what a process, how we can carry out this phenomenological research design is that main thing, we can have a communication, and whatever we get, the communication from the participant, that can be translated into according to our own understanding. And after that, it can be returned. So this is a nomenclature, like PRRA. So communication should be there, what we exactly receive, and how it can be translated according to our own coding has to be there. Thematic presentation, like how it can be. So theme based, how we can understand their communication, whatever they have shared, and communication through write-ups. So this is what a process is. So 3 steps has to be followed when you are doing your any kind of qualitative research design. So what to do? First, it can be done through making an interview, maybe by oral interview, or you can take a notes or audio video, and it can be organized in a written form. Transcription should be there, and the general description, data analysis to be carried out. This is what we can do it in a phenomenological research design. And coming to ethnography, what do you mean by ethno? It means it is a group of people. Graphy means writing. So here, for example, like here I have quoted that a study focusing on organ donation beliefs of Indian women living in a rural area. What about their beliefs or perception towards organ donation? If you want in the group of people in a particular area, in a particular community area, in a particular north side or a south side, if you go for that, like from that, we can, if you want to obtain all the information from that particular area in a writer form, it is called ethnographic area. So to know the culture and distinct group of people, like so how they are following and gathering information by observing the interaction of the people. And it does mean that the researcher, the people, those who are interesting to do a ethnographical, they are going into depth, get inside, get along with the people study about the people. Each and everything will be observed. That can be described in the form of culture, like, no? So this is what called as ethnographical research, qualitative. It's a kind of qualitative research. So here you have to select the topic in where depends upon the area of your interest, and question, what are the questions to be asked, collection of the data, and making a record either in the form of written and video, and analyze the data and write at last going for your write-ups and produce your result as such. And the data, how here is transcription, field documentary analysis. So these are the forms from which we can collect, like formal interview, informal interview also can be, and a participant observation. So each and everything. So here I can say that the ethnographic researcher, they have to go along with those people. Each and everything has to be observed. everything should be measured with, sorry, everything should be monitored, and all those things should be recorded or documented. So this is what which we are in need of ethnographical research design. And historical research design, a study on the development of nursing in India. So here, so it is simply said that how we are examining the past events of the past, So it is a systematic compilation of the data and critical presentation, evaluation, and interpretation of fact regarding people, events, and occurrence of the past. So here, how far doing it in the past, how we are following it in the past. So whether it is how we would be able to examine the past events, and that can be reproduced in the form of your research article. And greatest value of this research historical knowledge is increase in the self-understanding only. It can be provide the nurse with increased understanding of their profession. Uh, so this is what historical. So previously in the history and all this area where we have had a touch up, and from there where it can be examined, and from that now we can even frame our own theories also by doing your historical research. And coming to action research. So here, a study on workability of nursing practice protocol in carrying patient with COVID, action report. This is an example here. So here, learning by doing only. Action. Our action should speak about. Identify the problem, do something to resolve, and see how successful the effort taken. So if not, so effort taken. If anything is missing in that particular area or the particular field, so what innovation can be carried out? So you can just try whether there is a expected outcome is reached. Okay, fine and good. If not, then again try your action only instead of your documentation or the written compliance, your action only talk about it. So this is through action we can do some innovations, like we can come to the just like that on the one night or the one day we cannot intervene any new matter, but we have to keep on trying until it come to the point of what we expect. So here this is what our action research. So it is inquiry or research related to focused efforts to improve the quality of the practice. So here the research with people, then research on people. So with the people, on not on the people. This is what the main thing of which I want to elicit on action research. A desire to bring out the action in the form of the change. If you want to bring out some change, you do the action, reaction, action, reaction, and it come to there may be a completely, there will be a change. Develop an understanding which informs the change. So this is what action research. The steps of action research is initially you have to plan first, act upon the plan, and observe whether there is any lacunae or what is the benefit of that, anything lacunae, and you can reflect among this. If there is any lacunae, so how are you going to fill that gap? So that again and again you have to, by your understanding, again you can refine and try, and at last you can bring to the you refine your action and come to the conclusion of your change. And coming to case study, that it is a depth detailed examination of one particular case in the real world context. So here, for example, study approach to explore the nurse's pediatric pain management process. So here we can see that we take one study, one case, and go into the depth and what are the merits and demerits, what is the positive point and negative point. Everything has to be examined in narrow down the very broad field and coming to the researchable point of view. So a series of similar cases in order to inquire about the phenomena, population, and general condition, the collective case study. So going to depth and detailed examination of the particular case. And so you have to just narrow down from the, you narrow down a very broad field of research into one or few easily researchable areas. And ground theory, which is very important, is based on the theory. It is a social process and social structure develop. You can even by approaching, by finding out you can even frame your own theory. You can even develop your own theory about the phenomena of interest based on ground theory. So it is something specific to general we can go for. This method can use to conduct some field research work as such. So this is how we can do your ground theory over data collecting, notes taking, and coding has to be done, and memoing and sorting the written. Sorting out and writing the solution, what you have found out. So basically, even by using this, even you can frame your own theory for any particular field or any particular aspect as such. The grounded theory study of the intention of nurse to leave the profession. So here you can weigh what is the intention of the nurses to leave the profession. If you have interested towards this point, based on that, you can just collect the data, have a note on it. You can have a coding like that. You can have a coding and you can like and sequence them with whatever order will make your theory clear. And you can make a short, you can sort it out with the skeleton in the words and make it as a thesis. And yeah, so it is something with your write-ups only, it will be elaborately told. And at last, so this is a glimpse of all the, in order to, for you to remember easily, so non-experimental design, some mnemonics I have given. So DCC AR. D, it is a descriptive descriptive design. And C, compare existing groups, some comparative descriptive design. C for check correlation. And C for cross-sectional analysis. And A for retrospective exposed facto. And R for run forward prospective, and R case control. So when you think about non-experimental, either in the exam point of view, and you can easily remember that DCCAR. So you can just, from that, you can easily elaborate the main point of each word. This is what we have covered in non-experimental design. And coming to experimental design, a true experimental design, we have seen the main core types is three: true experimental design, quasi-experimental design, and pre-experimental design. In true experimental design, we have seen so many things like, so here, if you remember this, please post some flesh cookies. So pre-test, post-test only design. Yes, some stands for Solomon. F stands for factorial, fresh, and cookies crossover. So this is too easy to remember the types of true experimental design with the term mnemonic. Please post some fresh cookies. And coming to quasi-experimental design, where you can see that nurses innovation track states. So non-equivalent and equivalent and time series and separate sample. Okay. And pre-experimental design, one shot, one static, one shot, one group and static. So if you remember this, all things, it is easy for you to remember all types of, all the classification of true experimental and non-experimental design. Coming to qualitative design also, here we can just here. Please give every curious nurse handy answer. Phenomenological, P for phenomenological study, grounded theory, ethnographic case study. Narrative, it does mean that unpack the stories people tell to give meaning to their life. Historical, examine past circumstances, and action research, collaborate with the participant to create change while studying them. So qualitative research design, when you think about qualitative research design, please have a note on, please give every curious nurse handy answers. At last, how to choose the design? It is so all the things it is being dealt, but without your interest, without the researcher interest, without the researcher consent, we cannot force to select the particular research design as. So here you should have, I wanted to know what caused something else. Anything is, any change is being taken place, what is the consequences, what is the benefit? And really, I wanted to understand the meaning of the behavior. So this also should be carefully understood by the researcher. And I want to generalize my result to larger population. I want to know something changes. So these are the things that are very essential for each and every nurse, researcher who is
Excuse me, Maria ma'am. You are muted. Kindly unmute yourself, ma'am. Maria ma'am, can you hear us? Okay, so dear participants, although it was, yeah, Maria ma'am, can you hear me? Over to Neha Dubey ma'am.
yeah, I'm not
Thank
muted.
you, ma'am. Yeah, yes, Maria ma'am. Actually, we are unable
Yes.
to hear you, maybe due to some network issue.
Am I audible?
Yes, now audible,
Yes,
ma'am.
ma'am.
Yeah, only 2 slides.
Yeah, you can continue, ma'am.
Yes, sure.
So it is forces are very essential for making your design, research design. One is your creativity is essential, the innovation, the complexity. So how far you are going to deal with, how far you are going to frame, or how far you are going to plan for it, and compromise and choice. So with that, I conclude. I think I have done a justification. It is it is a very huge subject. It is 1 hour is not actually enough. But still, then I hope that I have made a justification. If you have any queries, because here I think it is a network issue.
Yes, ma'am.
Thank you, organizer, for having this wonderful opportunity.
Thank you, ma'am. Thank you for sharing your expertise with us today. And your presentation was incredibly valuable and very informative, and especially the part of the classification of research design. So your presentation was very informative, ma'am. And I would like to request all the participants